Okay. And also if there are any changes in the procedure, equipment, chemicals, or personnel. Medical surveillance involves the employee completing a medical questionnaire. The questionnaire gets reviewed by a physician. If it's necessary to take a medical exam, they'll take care of that. And you may be able to return to your duties. You know, let's say you've had a problem, or let's say that the concentration of formaldehyde was over a certain level, and you got sick from it. The physician will give you a medical exam. You might have to not be in the prep room for some period of time. At some point, you may be able to return to your duties. You may be reassigned to something else because you just can't work in the prep room. Or you may be terminated. It is possible for you to be terminated because if you're hired to be an embalmer and you can't work in the embalming room, then... Okay? And this is just a little chart of inhalation effects from formaldehyde, okay? From 0.5 to 2 parts per million, irritation of eyes, nose, and throat. There's tearing of the eyes, and intolerable for some people between 3 and 5 parts per million. 25 to 30, severe respiratory tract injury. 100 parts per million is immediately dangerous to life and health, okay? Like you might not survive 100 parts per million. Okay, so that was OSHA. FTC, as far as embalming is concerned, there were 2 main things. You can't say embalming is required by law. It's not required by law. Okay, so you tell people why you're requiring embalming in your funeral home, but you can't say that it's required by law. As you know, funeral directors used to do that. You know, that's how they got people to go for the embalming. They said, well, you have to. It's required. And you can't charge a fee for embalming unless you've been given permission for embalming. Okay, so that's why you want to ask for permission first. If you didn't get permission, you can't assume that the person is going to want to be embalmed and then go ahead and embalm them. Okay? And these disclosures have to appear. The first one has to appear on your general price list. The second one has to appear on your itemized statement of goods and services. And if you work in a funeral home, you can go and pick up those documents and you'll see, you should see those disclosures. Death and embalming changes. I'm not going to spend any time here. These are these little charts that you have on this handout that I gave you. You know, the one with all this on it? And they're blank on your sheet. So you get to fill them in, go home, don't do it today, tomorrow, go and look at them. Don't look at the other, don't look at this, just go to this first, good. Go to this first and fill them in, see how much you remember just, without looking. And then whatever you don't remember, you can go back, you can either go there or go to your textbook.
Could you send the separate slides, because you can't really see it on the handout.
Sure.
Is that possible?
Yeah, no problem at all. I just didn't want to bog you down with a lot of paper. If I had put one slide to a sheet of paper, I think I've got 60 slides or something like that. Okay, so here are your pre-embalming changes. I don't need to spend a lot of time on these, I don't think. Hypostasis, livor mortis, alor mortis, dehydration, increase in blood viscosity, invasion of microorganisms. Does anybody have any questions on it? I say I don't need to spend time, but if you have questions, we can spend time. Okay. And then we have our chemical changes. So we have postmortem caloricity, shift in pH. Remember, your body is slightly alkaline during life. After death, it goes down into the acid range, and that's where it is during rigor mortis. And then as decomposition starts, it goes back to alkaline. Okay? Rigor mortis, postmortem stain, and decomposition. The good thing of understanding about decomposition, postmortem stain, and rigor mortis is if you understand what they are and you know that the body is in those conditions, that tells you that the body has been dead for a while and it has a greater preservative demand. Okay, so you're going to need a strong solution to embalm them. A couple of words about embalming analysis. Basically, this is observing the body, proposing a treatment for it. In other words, deciding what vessels am I going to raise, what type of solution am I going to use, etc. And you then implement that, and then look at your results. And if the results aren't as you're expecting, you change your plan. Okay? You repeat the cycle. Observe again, treat again, implement, and your results. Okay, until you're finished. And again, it helps you to decide things like what vessels are you going to raise, your injection drainage technique, what type of chemicals, how are you going to close the mouth and eyes. Remember, everybody can't get the same treatment. If you have an elderly person who has no teeth, and you can tell that their jaws are not in good shape, you probably don't want to use a needle injector. Okay? Babies, you probably don't want to use a needle injector. Okay? You don't want a needle injector at all. I understand that. And remember, for eye closure, the eyelids abut. They do not overlap. Okay? I have a friend who, I don't think he went to AAMI, and he insists that they overlap. And, well, he does overlap them. I've seen the bodies. And I said, why do you do that? Well, that's what we're taught. No, they're supposed to abut. And he insists. And I'm like, if I close my eyes, look at my eyes. Do they overlap when I close them? So, okay. This is just some key points about embalming analysis that I, again, copied from the course. So these are things that you keep in mind. 3 guidelines that your textbook tells you when you're doing embalming analysis. First of all, the body has to be seen at all stages. So you need to look at what you're doing, okay? Practice universal precautions. We've already talked about that. And plan on delayed viewing and disposition. Even if you think you know that the person is going to have their funeral and be buried tomorrow, you never know when that's going to change. And sometimes when you know that it's going to be soon, you might do a little less. Okay? You have things to do. Your kid's got a hockey game, and you know this guy's going to have their funeral tomorrow, so I'm going to just kind of rush through it. Only then the funeral director comes in and says, you know what, the family changed their mind, and the funeral's not going to be for 2 weeks, and we have to ship them to Hawaii. All right? Well, now the person that you embalm may not be ready for Hawaii. Okay? So always plan for Hawaii.
We just got somebody shipped us from Hawaii 2 days ago.
Really?
That's weird.
Good condition?
No.
Oh.
Dry ice, weirdly packed in dry ice, no embalming.
Oh, okay.
But she was like retired there, and they shipped her in a Ziegler.
Okay.
Haven't seen one of those in a long time.
Yeah, me either.
Undoing that is a pain.
Oh, is it? Okay.
The Ziegler case?
Yeah.
With the screws on the whole thing?
Yeah.
I don't know. Sorry.
But dry ice, that's...
It's weird that she said Hawaii. I don't know.
But that's another thing to think about. Refrigeration is becoming a little bit more popular. There are a lot of people that don't want to be embalmed, but they still want to have a service, or they still want to be shipped. For funeral, like for Jewish funeral homes that don't embalm, but everybody's coming up from Florida to be buried, so they'll use dry ice, and you can pack the dry ice in different places on the body so that they can be preserved until they're buried. Okay. Remember that no 2 bodies are alike. So you can have 2 bodies, same age, both died of a heart attack. Don't assume that you're going to have the same issues, or you may have no issues with one. You can't assume that you won't have any issues with the second one. Everybody's different. Walk in with that thought in mind. Always be prepared to change what you're doing if you have to. All right? And this last point is just my own little opinion. You can tweet this. Performing embalming analysis, what separates the good embalmers from the best ones. All right? These are some generalizations that you can keep in mind for postmortem conditions. Okay? If you think there are going to be problems with circulation, start with the common carotid and internal jugular. Don't use a pre-injection solution. Pre-injection solutions have very little or no preservative. Okay? They're there to prepare the vascular system. If you're going to have problems, if you think the vascular system has problems, don't waste your time injecting a non-preservative solution in there. you're just kind of wasting your time. It's not going to help preserve the body. It's only filling up this circulatory system that you're now going to have even more problems trying to inject your solution into. Okay? If you're going to inject large volumes of solutions into the trunk for whatever reasons, but you don't want to over-inject the face, restricted cervical. I don't know if you noticed, but our textbook really pushes restricted cervical. All right? And it's probably, according to some people, I've heard it's becoming more the norm rather than 1 point. 1 point injection is a luxury. I don't know about that. I know a lot of people do 1 point a lot. But I got to the point where I use a lot of restricted cervical, just right off the bat, just open up both carotid arteries. If you've already injected a strong solution into an area, don't bother going back and injecting a mild solution. I don't know why you would do that. It makes no sense. Okay? Increase solution strength after intravascular discolorations have been removed. Because if you introduce a strong solution, you may set the stain. Okay? They may become extravascular discolorations and they may be set. So now you've created a discoloration that you don't want. Don't confuse cause of death with manner of death. Cause of death is what caused the person to die. Manner of death are the categories into which the death might fall. So if you've had a chance to look at some death certificates, you'll see there's an area for cause of death. How did the person die? Okay, what were the reasons that they died? But how did it happen? Okay, was it an accident? Was it natural? Was it suicide? Etc. Okay. Here's some key terms going back to vocabulary, just things to remember. Primary dilution, secondary dilution, preservative demand. A lot of times, if I gave you a question that said, what is the amount of preservative required to effectively preserve remains? Some people want to give me a number. Okay, well, it's 2 gallons, or 2 gallons of a 2% solution. Or no, it's the preservative demand. That's the definition of it. Okay, so that could be kind of confusing, so just remember that. Okay, for chemicals. By the way, don't mistake the index of your fluid with the index of your solution. There are 2 different things. The index of your fluid, remember we said they're 5 to 15 for weak fluids, and then 16 to 25 for medium, and 26 to 36 for strong solutions. That's fluid. But when you mix your solution, now you have things like a 1% solution is a weak solution. A 2% solution is a medium strength solution. A 3% solution is a strong solution. All right? So you have to be real careful about that, because I just gave a midterm and I said, which of these solutions would you not use on this particular body? And a lot of people selected the 3% because they said, well, that's weak. Well, no, I'm not talking about fluid. I'm talking about solution. So make sure you know the difference between those. Okay? Unless you really want to go through chemicals and anatomical considerations, we can come back to that. But I'll just finish going through here, and then if you have specific questions about those, we can do that. Because those are other presentations. Injection and drainage, make sure you know the injection techniques and the drainage techniques. I may have put a table on that document for you to fill in to make sure you remember those. I won't go through that. We already said the center of drainage is the right atrium. Remember that drainage instruments are inserted into veins, and they're always inserted towards the heart. Broken veins can still be used as drainage sites, so don't worry about, if you're trying to raise a vein and you break it and you think, oh, man, I got to go raise another vein. You don't have to. If you can grab it, you can use it. Okay, you can always hold it using your forceps or your hemostat. And then techniques for improving drainage. Make sure you select a large vein. That's why the internal jugular and the femoral are the most often used. Make sure you have a drainage instrument that fits into the vessel, but don't have an instrument that's larger than the vessel because you'll damage the vessel. Use a pre-injection if it's appropriate to clear discolorations, and remove any extravascular pressure. So if you have severe ascites, what is ascites? Edema where?
Stomach.
Stomach. Abdomen, okay? If you have somebody with severe ascites, like their stomach is sitting out and you press on it and it's like, it's hard. You may want to try to aspirate a little bit of that fluid out before you inject, because that provides extravascular resistance on the vessels and it might keep you from getting good drainage, okay? And good distribution of fluid also, okay? But be careful when you aspirate that fluid out. Be careful if you do any aspiration prior to arterial injection, because if you go in there and you're not paying attention and you break up vessels, you're not going to get good distribution. And so now you've got to do a 6-point injection or whatever, okay? And by the way, for your injection methods, remember that 6-point injection is usually when you're talking about autopsies, you're talking about 6 specific points, okay? You're talking about the common carotids, either the axillary or subclavians, and the femoral or external iliacs, okay? That's a 6-point injection. But if I start off using the right and left common carotid, and then I have to raise the left femoral, and then I have to raise the right brachial, and the right radial, and the right ulnar, if I end up with 6 arteries, that's not a 6-point injection. That's a multi-point injection. All right? 6-point really refers to 6 specific points. Okay? Also remember that split injection is not a multi-point injection, because when they talk about injection methods, it's not the number of incisions you make, it's the number of vessels you raise for injection. All right. So for split injection, you're raising you're making 2 incisions, right? 2 different places, but you're really only talking about injecting in one, because you're injecting in one artery, but you're taking drainage from a different vein, okay, or a vein in a different part of the body. Okay. So everybody remembers that? Okay. Let me skip that. Cavity embalming, just real quick. These are just pictures of your trocar guides. So there's one for the right side of the heart, for the cecum, the urinary bladder, and the stomach. Okay. For the cranial cavity, remember that only the anterior portion of the cranial cavity is going to be aspirated. Okay. You're putting the trocar up through the cribriform plate and into the cranial cavity. It's only going, because of the bones in the face, it can't go all the way to the back, right? So you're only going to aspirate the anterior portion of the cavity. And this just goes into conditions necessitating treatment for cranial embalming or aspiration. I'm sorry. Let's see. Reaspiration and reinjection. You can read that. There are times when you're going to want to reaspirate and reinject cavity fluid. Okay, so if you embalm somebody today and they had lots of edema, or they're obese, or they had some other, they were in decomposition, or had some other kind of problem, you may want to reaspirate them before you dress them. Okay, and if you're not paying attention, you may have to reaspirate them after you dress them. Okay, very quickly. These are some of the things that you do before and after embalming. Some of these are not set in stone. You don't have to do all of these things prior to embalming. A lot of people will say, well, you should set the features. Well, a lot of times I've set features after embalming. Okay, I mean, you can kind of put them in place, but maybe you don't suture the mouth closed right away. Okay, you can make sure the eyes are closed and that sort of thing. You do want to align tissues if you have lacerations or anything like that. But some things you can wait until after you've embalmed. Different ways of closing the mouth, make sure you go over those. Treatment of invasive devices, make sure you remove pacemakers if the person is going to be cremated. Okay, generally you remove the pacemakers all the time, unless you're told not to. And again, here's some more, and you'll see some of the same things on both lists, because you'll treat them before or after. Some things you'll treat before and after. Okay, broken bones, you're going to realign them before you inject, and then you're going to, that way they'll be set. All right. Lacerations, you're going to, like I just said, you're going to align the tissues prior to embalming, and you're going to use like bridge sutures. Those are the temporary sutures. Then after embalming, you take those sutures out, and now you're going to use one of those invisible sutures to suture it closed. Okay. And here I talk a little bit about those sutures. You can see those. Just remember, plastic garments. I meant to put some pictures here of plastic garments. You can look in your textbook and see those. Make sure you know what they are. People still, for example, capri pants.
Yes.
When you think of capri pants, don't think of the capri pants that you wear, or or your wife or your girlfriend wears. They're not the same. The capri pants have feet in them, okay? But they're from the waist to the feet. They cover the feet, all right? The other thing about plastic garments, remember, you really only use as much garment as you need. So if the person has a decubitus ulcer on their thigh, they don't need a union-all, okay? There's no reason that they need something that covers their entire body if the problem is only in one place. Okay, so make sure you know what the garments are and use the ones that...
A union-all and a coverall. What's the difference?
The coverall is from here to the thigh. Okay, it just covers the
You should
trunk.
really change that name, you know?
Yeah.
Well, if
Cover
they
all
ought to
doesn't
change...
cover all.
It doesn't cover all.
And
It's crazy.
and they ought to
That's
change the
what
capri
And it
pants
makes
since
you
they're
like,
not
if
the
you're taking
same.
a test, you're like, you really check, wait a minute, covers all.
Yeah.
Is he getting there? Yeah, okay. So union-alls covering
Union-all
all.
is the whole body. The coverall is from here to
So
here.
like your torso.
Okay, yes.
Torso. Torso all.
There you go.
Interesting.
Don't forget terminal disinfection. And remember, because it blows my mind that I ask this question a lot on tests about concurrent disinfection and primary disinfection and terminal disinfection, and people get that confused. Concurrent, the same time as you're embalming. Primary, before you start embalming. Terminal, after you finished embalming. Okay, so just remember that. And then documentation, monitoring remains. Monitoring remains is important. Okay, as long as that person is in your custody, you make sure they're okay. So if you finish embalming somebody today and the funeral is not until next Friday, you better go in and check that body as often as you can. Just make sure they're okay. Hey, how you doing? Your face becoming dehydrated, something. But especially if you keep them in the refrigerator, go and look and make sure they're okay. And take care of any problems that they're having. They might be purging. They might have any kind of problem, and you want to check on that. Okay? And these are just post-mortem conditions that we've talked about. You might want to think about those. You can check them out in your textbook. These are the kinds of cases that you're going to run into most often, and you need to be able to recognize the types of treatments that you would use for each of them. Okay? And anything that can possibly go wrong does. And by that, I don't mean to say that something is always going to go wrong, but I want you to keep in mind that something can go wrong, so plan for it. Okay? Try to avoid it. Try to avoid something happening if you can. For example, my favorite example is the very first time that I was by myself. Everybody went on vacation, and it was I think it was over New Year's, and it was hard for me to find anybody to help, so I had to do a lot of things by myself. So I embalmed this guy, and a couple days later, it was almost time for his funeral, and so I dressed him, and he was fine. But when you're dressing somebody, you're moving them all over the place, getting their clothes on, because we dress everybody completely. There's no cutting the clothes down the back and putting them on. And got this guy literally completely dressed, and as soon as I finished getting everything on him, exactly, that's exactly what I heard. And I thought, you gotta be kidding me. And so fortunately it wasn't too bad, because I did have cotton there, so I didn't have much to clean up, but I did have to take his pants off and put plastic pants on him. to make sure, and I think I aspirated him again and plugged the anal orifice to make sure that it wouldn't happen again. But from then on, you do something to make sure that doesn't happen. You plug the orifice, you put on plastic garments, whatever, okay? Because if you don't, chances are something's going to happen and you're going to be sorry. So just keep that in mind when you go into embalm. Okay? That's all I have for this presentation. Does anybody have any questions?
No, if I do, I have your email.
You have my email. Everybody has my email, right?